Shalom, Israel. It's your brother Marcus G back with yet another truth for thought. First and foremost, I must give all praises, honor, and glory to the Most High. I must give all praises, honor, and glory to the Most High. Secondly, today's truth for thought was, believe it or not, as with a bunch of my truth for thoughts. Believe it or not, Israel, the Most High always gives confirmation for things. I hadn't done a truth for thought on medical insight for my nation in a little while. I don't know exactly when. I have to go back and look at my videos to see. But I hadn't done a truth for thought in regards to medicine, and obviously long enough, because there was confirmation. Last week, I was reached out to by one of our queens, one of our sisters, Queen Alicia, and she sent me a direct message on Instagram saying, King, I have a couple, they're in the truth, and you have to speak with them. Now, right away, I knew for her to tell me, because she too, I spoke with about medical things, okay? So right away, I knew it was probably something in regards to a medical thing, on top of the fact of probably just other general questions, biblical questions, as she did mention, they are in the truth. So the Queen Alicia sent me this, and I promise you, no more than maybe 10 minutes, I received a friend request from this queen, from the queen of this couple. I'll put it like that. Now, as I received this from Queen Alicia, so did my beloved King Mike Malice. He received a message similar to that I received. So he said, you know what? And we were on the phone together. We were literally on the phone as Queen Alicia said this. King Mike said, you know what? I'm finna reach out to him. I said, all praises. I said, if it's something medical, make sure she reaches out to me. So they spoke, and I'm sure that King Mike wouldn't have a problem with me saying this. They spoke, but nothing medical came up. All right. So she then sent me a message. And since nothing medical came up, King Mike didn't, say, let me know, yes, you need to speak with him. However, again, keep in mind the message from Queen Alicia. And my discernment of it was, there's more to this. There's probably something medical going on. Now, she did mention it to King Mike, right, naturally. So the next day, I want to say, I may be incorrect. Queen Sharon, you feel free to correct me if you're in the comment section. I'm going to say it was the next day. It may have been 2 days later. She reached out to me and said, Shalom, King. Queen Alicia suggested that I reach out to you. And now, again, I've already accepted her friend request. I said, Shalom, I'm here, if, there's anything you need. that I can possibly help with. Long story short, after a couple of texts, I call her and I speak with her. And just as I discerned, there was something medical, not just with her, but also with her king. So we speak for a minute. I give her some information, trying to walk her through what it is she's going through. And so I even told her, this is confirmation. It's time for me to do another truthful thought on medicine. Shortly before I got off. And I also spoke with her husband, who does have a medical issue as well, which is one that I've already addressed in a past medical insight for you, Israel. But I've yet to address the issue or the system in regards to her disease process or disorder. Okay, so that led to this. That's what led to this truthful thought. But today, Israel, the truth for thought is a medical insight for you. This is part 4, and it's in regards to the central nervous system and a direct disease process or disorder in multiple sclerosis. All right, in multiple sclerosis. So before I go in and start explaining everything from the central nervous system to certain chemical medications that are used via Western Hemisphere medicine to treat multiple sclerosis, all the way into herbal modalities, treatment modalities for multiple sclerosis, you got to go to the Bible. Must go to the Bible. I have to get some scripture. Now, it's not much. It's only going to be 4. We're only going to go to 4 different places in the Bible. However, there are more scriptures in regards to herbs. If you've not seen them, I do implore you, go back and watch the Truth for Thoughts of Medical Insight for You, Israel, parts 1, 2, and 3. Part 1 is going to have the most scripture in it of all of them. All right. Just in case you want to know other scriptures in the Bible in regards to herbs. All right. I've also done certain truth for thoughts, such as the one on monkeypox, which is highlighted with the treatment of certain leprosies with herbs. All right, so let's real quick, I'm gonna share my screen and we're gonna go to the Bible. And what we're gonna do is we're gonna go to Genesis 1. We're gonna go to Genesis chapter 1, and we're gonna get verses 11 and 12. All right. And they read, and God said, let the earth bring forth grass, the herb yielding seed, and the fruit tree yielding fruit after his kind, whose seed is in itself upon the earth. And it was so. A lot of the things that are being sold today, such as seedless grapes, that's not a natural grape, because as we see here, in verse 11, fruit yielding tree after his kind, whose seed is in itself. So if you're buying seedless oranges, seedless grapes, this is not your natural. This is a strange orange and strange grape, because the natural orange or the natural grape has its seed within itself. Verse 12, and the earth brought forth grass and herb yielding seed after his kind, and the tree yielding fruit whose seed was in itself after his kind, and God saw that it was good. Herb yielding seed after his kind. This is the first today of the truth thought I'm doing today. The first proof that the Most High provided herbs, and he saw that it was good. He provided herbs all over the entire planet. And these herbs are good. But let's keep going. Let's drop down to verses 29 and 30. And God said, behold, I have given you every herb bearing seed which is upon the face of all the earth. That literally just echoed what I just said. But here you actually read it from the Bible. And every tree in the which is the fruit of a tree yielding seed, to you it shall be for meat. But I will tell you, not only for meat, and we're going to get it just a little later. And to every beast of the earth, and to every fowl of the air, and to everything that creepeth upon the earth, wherein there is life, I have given every green herb for meat. And it was so. So understand, Israel. First, the herbs are good as the Most High deemed them so. Second, you see the phrase, wherein there is life. Israel, I want to ask you something. And I just want to see. For those who own dogs and know a lot about dogs, I own dogs. I own a pit. I've always owned dogs. But there's this thing about dogs, when they are sick, and I want to know if any other dog owners notice this. A lot of dog owners know this, especially around my age or older. When a dog is sick, he'll start eating grass. Have you noticed that, Israel? But now if you look at verse 29, it says, and God said, behold, I have given you every herb bearing seed which is upon the face of the earth, and every tree in which is the fruit of a tree yielding seed. To you it shall be for meat, and to every beast of the earth. Would a canine be a beast? And to every beast of the earth, and to every fowl of the air, and to everything that creepeth upon the earth, wherein there is life. Is a canine a beast? And does it have life? Does it live? So it is no irony or coincidence that when a dog does get sick, Dogs that have heartworms will eat grass. Dogs that have stomach worms will eat grass. It is not irony or coincidence. There is a very real and rational reason for it, and it's right here in the Bible. All right, let's go from there because I don't want to spend too much time. I don't want to have y'all for too long. We go to Genesis 9:3. Every moving thing, this is just a precept to what we just read. Every moving thing that liveth shall be meat for you, even as the green herb have I given you all things. Now, this he's speaking to man. The Most High, as he said before, and as you can read in several places in the Bible, is literally saying, I create all things. Even, I'll repeat the end of verse of Genesis 9:3. Even as the green herb have I given you all things. So if you are someone who has the understanding that something evil is not created by the Most High, I promise you, there are scriptures that show the Most High is the creator of all things, good and evil. However, we read back in Genesis 1:11-12, he made herbs and said it was good. So this is a good thing that is further being proven he created. All right. And it's further proven it's for man. All right. So now let's go to Psalms 104:14. Because I said in Genesis 1:11-12, as well as Genesis 1:29-30, the Bible says for meat. And I said not only for meat in regards to herbs. So let's go to Psalms 104:14. Psalms 104:14. And let's see if herbs can be used for any other thing. He causeth the grass to grow for the cattle, and herb for the service of man, up to and including medicinal service. Up to and including medicinal service. In fact, in Leviticus 14, you'll see the treatment modality for certain leprosies. And outside of some animals, you'll see hyssop and herb. You'll see a type of bark of a tree, a type of herb. These types of things have always been used by Israel. And in fact, these were the Levites who would utilize this because they were the priests. And you'll go back there. If you go to Leviticus 14, you will see it mentions the priests as the ones who are cleaning these leprosies or treating these leprosies prior to deeming the person clean and then cleansing them, everything from their skin, sometimes shaving them, to their clothing, their garments. But included in that is herbal treatment modalities. Let me finish this. That he may bring forth food out of the earth. So herbs, And I'm gonna stop sharing my screen. Herbs, yes, undeniably can be used as meat, a type of food, all right, as well as for service, up to and including medicinal service or a type of treatment modality. So again, this medical insight for you is going to be on the CNS or central nervous system, and we will be highlighting multiple sclerosis. So Queen Sharon, when I spoke with you, I told you this happens ever so often, which is why the medical insights for you, Israel, are so spread out. That's why this series is back to 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 back. As Israel, the Most High uses any and all of us or anything as confirmation. Each time the Most High presents me with another person with a medical issue. It's confirmation for me. So Queen Sharon, you were confirmation. So let's get into it. Those are the only scriptures I'm going to bring out today. All right. Everything else is going to be medical, chemical, and herbal knowledge. All right. So with this said, let me share my screen again. All right. I'm going to share my screen again. The first thing we're going to get is what is the central nervous system. Okay. We're going to look at the CNS. And first of all, I can't lie to you, Israel. I've already repented for that. I can do that sin no more. The central nervous system, as we're going to read it, it consists of specific parts, but I want you to understand the central nervous system is just the center of the entire nervous system. So yes, I'm going to get in depth about the central nervous system, but I want you to understand the nervous system consists of two parts. You have the CNS or central nervous system, and you have the peripheral of the nervous system. So you have the central nervous system, and we're about to talk about it, and I want to explain the peripheral. The peripheral portion of the nervous system is the extension of the nerves beyond just the CNS. And the reason I have to say that is because, especially for people with multiple sclerosis, the reason that this disease process is so debilitating is because it starts in the central nervous system, but will exacerbate or spread, for lack of better terms. Exacerbate is just a big term, big medical term for spread. And it's not so much a spread, it just extends. It will extend to the peripheral portion of the nervous system. So when someone with multiple sclerosis cannot feel their arm or cannot feel their fingers, which are the digits at the furthest upper extremity, it's no longer just secluded to the central nervous system. As we're going to go over the central nervous system, it's now expanded out into the peripheral to those nerve endings of that extremity. All right. And I want to make sure you understand that as we go into this further, so that while I'm walking you through this, you're walking alongside of me and not behind me, because you're like, well, wait a minute, how did it get to the fingers, or how did it get to the arms, or why is it affecting one's fingers or hand or elbow or arm or legs or feet? You see, I want you to already have a certain knowledge base, even heading into the knowledge that we're about to go into now. So, and trust me, all links to any and everything used, as always, I do this with all my Truth for Thoughts, will be in the description. So now, what is the central nervous system? Now, this is from the Medical News Today. This is an article from the Medical News Today. And I chose this one because it gives a real layman's term. Because trust me, we're going to get a little deeper into it. It gives a real layman's term, so that when we get more in depth, you'll already have a working base of knowledge, all right? Same as when I was talking about the peripheral of the nervous system. So the CNS consists of the brain and spinal cord. Remember, I said the CNS is the central part of the nervous system. This confirms that. The brain is protected by the skull, and it is the cranial cavity. That is true. When someone has swelling of the brain, it's referred to, again, this is in Western Hemisphere medicine, as intracranial pressure. So that further proves that the brain, yes, does sit in the cranial cavity. Sometimes you'll hear cranial vault. You'll hear it in any number of ways. It's all the same thing. It sits in your skull. This is your skull. It sits in that cavity. All right. And the spinal cord travels from the back of the brain at the base down the center of the spine, stopping in the lumbar region of the lower back. Again, this is the total center of the nervous system. All right. And again, I'm going to show, we're going to have a diagram that's going to show the entire nervous system, and you'll understand why I talk to you about the peripheral prior to the central. All right. The brain and spinal cord are both housed with a protective triple layer membrane called the meninges. That too is correct. And at the point of the spine started, there's also within the meninges, there's as well as within the brain, there's a surfactant. A surfactant, that word simply means there is a fluid there, because you got to understand this vault, everything on the inside of your body is at a certain pressure. You breathe, that changes that pressure. So there must be something there to reduce the surface tension. Thus, things like cerebral and spinal fluid. All right. So understand that the way that people get meningitis is that particular fluid gets infected. Now you notice meningitis is the word. It is the name given for a disease or disorder. Meningitis. It simply means the inflammation and possible infection of the meninges. Again, which line this central part of the nervous system, okay? The central nervous system has been thoroughly studied by anatomists and physiologists. but it still holds many secrets. Man will never have the knowledge of the Creator. The creation will never have the knowledge of the Creator. Ever. This is proof of that. It controls our thoughts, movements, emotions, and desires. It also controls our breathing, heart rate, the release of some hormones, body temperature, and much more. The retina optic nerve, olfactory nerve, and olfactory epithelium are sometimes considered to be a part of the CNS along with the brain and spinal cord. Now, I'll explain to you why. Well, this explains why. This is because they connect directly with the brain tissue without intermediate nerve fibers. So, these you may have also, it kind of depends on your knowledge base, but you may have also heard of the central nerves. These would be those central nerves that are generally classified with the central nervous system. So now let's get a little more in-depth breakdown of the central nervous system. All right. The central nervous system is the part of, and I want to make sure that you all can see this picture to the right. The central nervous system is the part of the nervous system consisting primarily of the brain and spinal cord. The CNS is so named because the brain integrates the received information and coordinates and influences the activity of all parts of the bodies of bilateral, symmetric, and triploblastic animals. Let me stop and break that down because that sounds real fancy. Your brain and the spine are the basis for voluntary movement. I'm just breaking down what they're saying in that first sentence, in that second sentence. For all beings that have a brain and a spine. That is basically what that is. That is, all multicellular animals except sponges and diploblasts. So pretty much all creatures, as you can read up, because even man is referred to as a creature in the Bible. So pretty much all creatures with a brain and a spine. Okay? It is a structure composed of nervous tissue positioned along the rostral or nose end to the colloidal or tail end axis of the body and may have an enlarged section at the rostral end, which is the brain. Only arthropods, cephalopods, and vertebrates have a true brain. Precursor structures exist in onychophorans, gastropods, and lancelets. All right. But if you notice this picture right here to the right, the brain and the spinal cord down to the lumbar section, right, is the central nervous system. Notice the extension of the central nervous system, which are the nerves and their endings, known as the peripheral nervous system. All right, and that is key to understand when speaking about such a debilitating disease, disorder, or process as multiple sclerosis. It is key to understand, although it starts at the central nervous system, and you see you see some of the signs and symptoms, such as lesions around the brain and spinal cord. Understand that it still affects the peripheral because you'll become numb in certain parts of your body. Well, that's because of the extension of the nerves from the central nervous system to that part of the body. All right. Let's go here. See, again, I went here so that you can see a better illustration of not only the central nervous system, as you see in this picture here, but also the peripheral. Also, because multiple sclerosis is classified as a central nervous system disease, it is only befitting that we get a little background on CNS diseases and disease processes. All right. Central nervous system diseases, also known as central nervous system disorders, are a group of neurological disorders and or disease processes that affect the structure or function of the brain or spinal cord, which collectively form the central nervous system. These disorders may be caused by such things as infection, injury, certain traumas, and I'll go into a little detail here. There are different types of trauma. There's cardiogenic trauma, which is trauma of the heart or the cardiac system. There is central trauma, which would be the central nervous system. There are different types of trauma or different classifications of trauma, again, per Western Hemisphere practice of medicine. All right. So where you see injury here, it's more so in the form of trauma, be it blunt, whatever type of trauma it is. When you see injury, it's due to a type of trauma. Splicing a nerve or getting stabbed in the back, literally with a knife, and severing the spinal cord. That's a type of trauma. All right. Blood clots, age-related degeneration, cancer, autoimmune dysfunction, and birth defects. The symptoms vary widely, as do the treatments for these different disorders or disease processes. Central nervous system tumors are the most common forms of pediatric cancer. Brain tumors are the most frequent and have the highest mortality rate. Some disorders, such as substance addiction, autism, ADHD, may be regarded as CNS disorders, though the classifications are not without dispute. Again, take from this that which is needed and understand. This is based on Western Hemisphere medicine, okay? A lot of this is true, but because it's based on Western Hemisphere medicine, which is based on a science of man, you'll see certain things as this last statement. Some disorders such as substance addiction, autism, and ADHD may be regarded as CNS disorders. They don't know what the fuck to call it. That they're admitting it. Then to try to save face, though the classifications are not without dispute. Basically saying some doctors may classify it as that, and it's not disputed within the Western Hemisphere medical world. And Those that don't include it, it's not disputed because they don't know. They don't even know how to classify. All right. Now, let's go from that to look at the disease process or disorder known as MS, multiple sclerosis. Again, understand this is Western Hemisphere medicine, and their wording can make you really, it can make you really consider, do these folks even know what the fuck they're talking about? Because again, listen to the first word. This is talking about multiple sclerosis. It says link to. Link to is not a definitive definitive. There are more definitive words they can use. They can say directly associated with, not linked to, because linked to that's broad. A lot of folks can hear linked to and go something anywhere with it. But I'm going to read it as they worded it. Linked to the central nervous system and primarily to the brain. So directly associated with the brain, for sure. Multiple sclerosis is a disease that causes serious complications. These can affect the day-to-day routine and social life of people. It has irreversible damage to the patients, and people need to understand the symptoms of MS that will help diagnose the illness at an early stage. This article briefly discusses multiple sclerosis or MS, sharing significant details about the disease. Now, the only thing that I want to get from this is right here where it says causes. Israel, you've heard me say multiple times, I can tell you something all day. If I cannot provide the why, you might as well be just as blind as me just telling you about something. Me telling you, don't walk in that street is not the same as don't walk in that street, because right up under that curb is an 8-foot drop. That's a big difference. That's a huge difference in an explanation, or in that it provides an explanation. So if I can't give you the why, I can't give you the explanation. Or if someone is telling you something and they can't give you the why or the explanation, I implore you, seek the why. Seek why this happened. All right. So let's look at some causes of MS. Multiple sclerosis is an autoimmune disease that attacks the protective layer or myelin that surrounds the nerve fibers in the brain. Now, this is a lot more detail than that we read just earlier in this particular article. The condition causes swelling of tissue and lesions, which I kind of went into a little earlier, around the affected area, which hampers the brain's ability to send signals to different organs of the body. So basically what it is these lesions and the swelling become an obstacle for that direct line of communication. The huge problem with it is that it's normally around the central part of the nervous system, which is why I said anything about the peripheral, because the brain is trying to send information as far as the peripheral portion of the nervous system. So that explains why I kind of went in about the peripheral portion of the nervous system prior to this, so that you can continue to walk alongside of me and not behind me, not left behind. All right. Which hampers the brain's ability to send signals to different organs of the body. Other complications include a curve on the spinal cord's ability to carry signals from the brain to different parts of the body. Again, so what that basically says is, if the lesions are around the brain, there's a block right there at the brain. But you might have lesions not right there at the brain, but at another portion of the central nervous system at the spinal cord. That now blocks the transfer of said information from the brain, again, to the peripheral or the other organs or the other digits of the body, all the way up to the digits. And fingers are digits, toes are digits. So as far away from the spinal cord as the toes and the fingers. The block is not exactly from the brain in this instance, but the brain sends a signal. It's going down a spinal cord. It hits some swelling. That signal is blocked. Likewise, the swelling or lesion can be at the brain. As soon as the brain fires the signal, it's blocked. So that's basically what this is saying in very, very layman's terms. Other factors that are key contributors to this disease are genetic and environmental factors. All right. So from there, it's time to go and look at the Western Hemisphere practice of medicine. Look at some chemicals. This particular, and again, I will read, as I always do, the link to everything used in this truth phone. I'll leave it in the description. This particular link is a list of 66 multiple sclerosis medications. This is only 66. This is 66 chemicals that are used for multiple sclerosis. Now, going all the way back to my first medical insight for you, Israel, your body has to metabolize every single thing that you put in. Right? It's much harder for the body to metabolize chemical things as opposed to natural things. Much, much harder. Much, much harder. I will go as far as to rephrase that statement by saying this. And I'm substituting the word chemical for unnatural. It's much harder for the body to metabolize unnatural things than natural things. Point blank. But I don't want to just say it. You can go to this site and you can actually go and see the average amount of time that each of these chemicals stay in your body after one dose. There are people taking a slew of these chemicals for the rest of their life. It's multiple doses. Yet the body must metabolize every single thing that you put in. All right. So I got this list here, and it's a couple I'm gonna look at. We're gonna look at Copaxone, which is the very first one here. We're also going to look at Filmetry, this one right here. So let's go and let's look at Copaxone. Now, the reason I want to look at these, first I want to look at these side effects. What can this particular chemical possibly do to a body that's already compromised because it has an ongoing disease process or disorder? And I'm just going to use multiple sclerosis because that's what it's used to treat in the name of multiple sclerosis. What can this chemical do to someone who is already experiencing the signs and symptoms of this very debilitating disease process or disorder of multiple sclerosis? These are the chemicals. This is a chemical used to treat multiple sclerosis. So alongside of the signs and symptoms of multiple sclerosis, these are some side effects that this particular chemical can give anyone that's taking it for multiple sclerosis. Let's just look at them. Some side effects may occur within minutes. Minutes. A minute is only 60 seconds. But within minutes of taking an injection of this chemical. Tell your doctor if you have any of these symptoms. Of course, the first ones that are going to be mentioned are those related to anaphylaxis or an allergic reaction, okay? Which would be itching, rash, swelling, warmth, skin redness, tingling. Now it's going outside of anaphylaxis. Tingling, anxiety, fast or pounding heartbeats, chest pain, tightness in your throat, or trouble breathing. The anxiety, well, that can kind of be included with all of these can be signs of anaphylaxis or a allergic reaction, an allergic reaction, not a allergic, an allergic reaction. Definitely the chest pain, the tightness in your throat, trouble breathing, fast or pound, tachycardia. Oh yeah, that's going to be with anaphylaxis. And again, remember I told y'all about the different kinds of shocks? There's an anaphylactic shock. So if a patient experiences any of these, they're definitely in anaphylaxis. If that goes for too long, that can go into anaphylactic shock. This type of reaction may occur even after you have been using Copaxone for several months. So they're telling you can have an anaphylactic reaction to this chemical on down the road. Now, why is this relevant? Normally, if you're allergic to something, the very first time that it's introduced to you, it shows the signs of it, right? And that is very true. However, this chemical, you can take this chemical for several years and then finally have an anaphylactic reaction. It's the reason why, and I think that when we talk, Queen Sharon, it may have been you, may not have been. A lot of people that take this also are escorted with an EpiPen. epinephrine used in the treatment of anaphylaxis. Also used in the treatment of anaphylactic shock, along with things like Benadryl. All right. Let's keep going. Call your doctor at once if you have chest pain, which may occur even after you have been using this chemical for several months. Again, cardiac issues can be caused even unrelated to anaphylaxis months, a lot of time after the initial dosages. So it's almost like saying one can never know if they're truly allergic to Copaxone based on them. They're saying this. I'm not saying this. It is a reasonable deduction to be made. You can be allergic to this and won't know it till years down the line. Years down the line of taking this chemical. Let's keep going. Hollowing or other skin changes where the injection was given. So they're basically saying right where you inject it, under the skin. It's a subdermal injection, which means under the skin, under the dermis. So it's a subdermal injection. This particular chemical can cause issues all the way from the injection site to up to and including anaphylaxis and anaphylactic shock. Thus far, from what we've seen, let's look at some common Copaxone side effects. Feeling short of breath. I will tell you, there are a lot of things that I myself am willing to feel, but the feeling of not being able to breathe is not one of them. One reason is because the body proves how important it is. You involuntarily breathe. However, if you feel like you didn't get enough air, you can voluntarily breathe in again. That's how vitally important ventilation and respiration, which ventilation is just the act of moving air from outside of the body to the inside of the body, while respiration is the actual gas exchange, the actual exchange of oxygen from that air and carbon dioxide from in the exhaled air. So that's the difference between ventilation and respiration, for those who didn't know. All right. But feeling like you can't do either of those two things, and you'll know if you're not respiring when they put on you what's known as a pulse oximeter that measures the percent of oxygen that's saturated in your blood. They normally put a little thing on your finger, and you'll see a little red dot going through your fingernail. That's to read the amount of oxygen that is saturated in your blood. Flushing, sudden warmth, redness, or tingly feeling. A rash or redness, pain, itching, swelling, or a lump where the injection was given. These are common side effects. If anything were to happen, these are the most likely things to happen as a side effect of this chemical. So I want to get a little more depth. Let's get a little more depth just with this particular. Again, this is about Copaxone. These are the serious side effects. Let me get it where you can read it. Serious side effects of Copaxone. along with its needed effects, or you may have heard me say before, its desired effects. The active ingredients contained in Copaxone may cause some unwanted effects, undesired effects. Although not all of these side effects may occur, if they do occur, they may need medical attention. Check with your doctor immediately if any of the following side effects occur while taking Glatiramin. That is the chemical name for Copaxone. Anxiety, bleeding, or a hard lump, hives or welts, itching, pain, redness, or swelling at the injection site. Chest pain, cough or hoarseness. That's going to be directly associated with anaphylaxis as you begin to bronchospasm somewhat, almost like an asthma attack, and your tongue swells. And believe it or not, people don't normally know this, but your tongue goes all the way back. It goes all the way back here. Thus, when you have sleep apnea, your tongue literally falls back over your airway. For those who didn't know, and I don't want to get too far off of what we actually talking about here, but these are just some nuggets for it. That's what causes sleep apnea. That's what causes snoring. It's like having a balloon and you're holding the top of it. And if you put your finger over it and start letting it go and just letting your finger flutter with, that is a snoring effect. That's how snoring is called. Chest pain, cough or hoarseness, excessive muscle tone. Start seeing things like, let's say my arm right here, okay? When it starts tightening and relaxing like that, you see that? That is excessive muscle tone. Your muscles start contracting really, really hard. You like, I'm not trying to make a muscle. What in the hell is my arm making a muscle right now? That is what that is referring to. Fast, irregular pounding or racing heartbeat or pulse, feeling of warmth, fever or chills, joint pain, lower back or side pain, neck pain. Now, remember now, this is a debilitating disease. And you're already going through the disease process, but this is what this chemical can, on top of the disease process, this is what this chemical can do. Painful or difficult urination, redness of the face, neck, arms, and occasionally upper chest, skin rash, swelling or puffiness of the face, swollen, painful, or tender lymph glands in the neck, armpit, or groin. Your lymph nodes can become swollen with the administration of this chemical. Trouble breathing. I literally told you that is one thing, boy, to know that you want to breathe, to know that you have to breathe. But to know that you can't or you're having trouble doing so, it's not a feeling that is not a ideal situation. Let me put it like that. Not ideal at all. Yet this is a common side effect with this chemical. Still, we can't put aside this is used to treat a very debilitating disease order or process. So while you're going through whatever the disease order, disorder, or process is having you go through, you can also go through this just from taking this to treat the disease process or disorder. Here are some less common, I want to keep it where you can see it, less common, yet still quite possible side effects of just this one of 66, a list of, and that's not all of the things that can be used in a treatment modality of MS. These are just the more commonly used things. But of 66 chemicals, and each have the same, they all have side effects, common ones, less common ones, just like this. The whole time to treat a debilitating disease, disorder, or process. The person is going through that and may have to go through these type of things for up to 66 based on the article, based on that I pulled up. But again, that's not all inclusive. There are other chemicals that have been used, will be used in the treatment modality of multiple sclerosis. I keep stressing that in hopes that it doesn't fly over your head. It becomes a double and a triple and a quadruple negative. The person has a disease processing disorder. So let's give them this. Although they definitely have the disease processing disorder, this too might happen, and this too might happen, and this too might happen, and this too might happen. Again, we're just looking at one. We're going to look at one other. We're just looking at one of these chemicals out of a list of 66, which is not all inclusive. There are others that are utilized outside of that 66. I'm trying to get you to understand the severity of this and how bad it could get just from the chemical alone, let alone the disease process that is there to treat, just from the chemical alone. Now, it's very true. The reason that one can safely assess that is very true, they have to list it. These are things that they have to make you knowledgeable of, yet they'll put it in the smallest text, on the smallest part of it, or they'll only mention so many of them. No one can say, but you didn't say, yeah, we put it right there. We said these and others. I'm going to go over those and the others. Less common: agitation, bloating or swelling, chest tightness, confusion. Why would I? Some of these things almost contraindicate given the chemical. See what man figures. And you'll hear this in the medical world. But the benefits outweigh these issues. Now, that's easy to say if you're one who doesn't have multiple sclerosis. It's easy to say the benefits outweigh the risk. But I've yet to see a person with multiple sclerosis explain to another person with multiple sclerosis, yeah, but you got to understand these benefits, they they outweigh the risk. That is what's known as a selling point. The Western Hemisphere world literally has to sell you on the idea of why to take these chemicals. Yet my people do it every day, all day, every day. For the tenure of lives, for the tenure of some of their lives. They don't know what these chemicals are doing to them. They were told, they were sold on the benefits outweigh the risks. Here are some of the risks. Again, is they have to, somewhere, they have to let it be known what the risks are. Let me keep going. Confusion, difficulty with swallowing. That comes from the swelling. Feeling faint, dizzy, or lightheaded. Headache, severe and throbbing. Itching of the vagina or outside genitals. Muscle aches or pains. Pain during sexual intercourse. Purple spots under the skin. You also see that a lot with steroids and corticosteroid use, excessive or chronic corticosteroid use. Chronic means over a long amount of time, while acute means over a short amount of time. When you can see it a lot in Esau, show up, look like red sores, purple sores in their skin. And it looks like a blood clot, actually, is what it looks like. Purple spots under the skin, red streaks on the skin, shakiness in the legs, arms, hands, or feet. Now, I'm going to tell you why that should be extremely alarming to anyone who has multiple sclerosis and takes this chemical. Remember, we went over the blockage of information from the brain to the leg, right? So that's if swelling or a lesion is there. Let's just, for the sake of knowledge, 9 times out of 10, most MS patients they've already had their initial lesion or swelling. Now, swelling you can kind of counteract swelling. But for those who've had their first lesion, remember that lesion obstructs you telling up to, and I even said up to the digits, the furthest of your extremities, which would include your fingers, arms, feet, or legs, right? Let's say someone with multiple sclerosis, they have a lesion present, it does block. And let's not even say a lesion. We'll just say swelling. They have some swelling, blocks that transfer of information. We'll say to this particular patient's left leg. But for some reason, this patient's left legs just keep shaking. We as clinicians or as caregivers, we have to go and look at the medication. Okay, is he taking Capoxo? Yes. It's the medicine making him do that. Now, the whole time, the body is doing an excessive amount with any type of, y'all might hear them as tremors or the shakes or spasms, a plethora of names it can be, even seizures. those muscles, all muscles require oxygen. And when they're working that much, that fast, for even a short amount of time, they require a lot of oxygen to keep doing it. And these, again, I'm just giving you some little nuggets. Things that maybe you did know, maybe you didn't know. If you didn't, now you do know. Small lumps under the skin, spasms of the throat. Just imagine trying to breathe while eating lunch and you start having spasming of your throat. I can't tell you I've ever had that happen to me. But this particular chemical can cause that exact thing to happen. Strong urge to urinate, sweating, swelling of the fingers, arms, feet, or legs. Thick, white, curd-like vaginal discharge without odor or with mild odor. Tingling of the hands or feet. I know that Queen Sharon, you're the one that gave me confirmation about doing this. And I can discern and Queen Sharon, please. I hope it's okay with me utilizing you in this example. I don't think that would be a good thing for you. From what I've discerned of you, my discernment of you is that you're a very modest person, very modest woman. And definitely someone who keeps herself up. I do know some women that don't keep themselves up. I knew of some. But even them, they wouldn't want that thick, white, curd-like vaginal dick. No. This is getting, just me reading this, beyond the notion of retardation. This is getting beyond that notion. Tingling of the hands and feet, trembling or shaking of the hands and feet, unusual weight gain or loss. Now, but look, there's more. There's a lot more. Rare things to happen. Blood in the urine, burning or stinging of the skin, continuous, uncontrolled, back and forth or rolling eye movements. This is now it is well beyond the notion of retardation. But I'm going to keep going because I'm going to give you all of the why. I have an understanding that even if I did have multiple sclerosis, this is a chemical I would not put in me. Decreased sexual ability, diarrhea, difficulty with moving. Now, this disease process itself is debilitating and will cause that. Now, the chemical that they want to give this person causes the exact same. This is an effect of the disease process itself. And we're only looking at one of them. We're going to look at one more, then we're going to go into some herbs. But I want my nation to be as educated and as knowledgeable as possible. It would take me 7 more hours to go through all 66 of those drugs. That's why I'm only going to go through 2 of them. But just going through this one alone, man, it's pretty much proof in the pudding for me. However, I'm just speaking for me. Some people, I gotta get down to some of these other things before they say, you know what, that's enough. I've heard enough. I don't want to take it. If I am taking it, I need to see about getting this discontinued or DC. Let me keep going. Ear pain, fast breathing, hyperpnea is what that's known as in the medical field. Irritation of the mouth and tongue or thrush, loss of appetite, menstrual pains or changes, painful cold sores or blisters on the lips, nose, eyes, or genitals. Now, there are many diseases that are through sexual intercourse. This particular chemical can mimic. I know people that if they see a cold sore, that is what they would assume. That is the initial assumption. I know clinicians that will assume that initially. Sensation of motion, usually whirling either of oneself or one's surrounding. Speech problems. Vision problems. Queen Sharon, I want to ask you, was that incident that you had, was that bad enough? Imagine taking this and your speech is like what we spoke of, but because of the chemical. Now you got to go to the doctor and they got to differentiate. What did this happen because of the MS? Or did this happen because of the Carpoxol? Because they won't know, Queen, I'm going to tell you. They're going to directly associate it with the MS. This chemical can make you do it every time that happens. They're not going to say it's that chemical. They're going to keep pushing that chemical. They're going to tell you this. The MS, that's that multiple sclerosis. That's why your speech was like it was that day in McDonald's, which we know that was the case then. But then the day at Wendy's, let's say you taking this and you go to Wendy's and it happened again. Before they say it's their chemical, they're going to say it was your MS again. Then you can go to Chick-fil-A. Oh, yeah, that's your MS. They don't want to even look at it. I'm telling you. It is ridiculous, but this is the case. Let's go to, there's more. And I'm going to go ahead and run through these. Hopefully I'm not prompted to elaborate on any of these because I want to go on and move on. I really do. Even though we're going to move on to another chemical, I'm almost like, when it comes to this chemical, I'm like, hey, like I said, it was enough for me a long time ago. But I want my nation, I want my people as knowledgeable as possible, even if it's just about one chemical. Abnormal vaginal bleeding or discharge, abnormal vaginal bleeding or discharge, lump in the breast or under the arm. Most of the times, and this is a question to all the queens and any princesses in the chat. I said, the very second one, I said, I hope I didn't see any that I felt the need to elaborate on. When you go for your mammogram and there is a lump discovered, what is the first thing it's associated with? But look, There's a chemical. To anyone that has multiple sclerosis, especially a queen or princess, I want you to just imagine you already have multiple sclerosis. You're taking this chemical. You feel a lump in your breast. You get alarmed. You go to your doctor. And I've seen it too many times. I know it's going to happen. First question that the majority of any female that finds that, do I have cancer? We need to do a biopsy, MRI, CAT scan, whatever it takes. We need to utilize every diagnostic tool because I know I got multiple sclerosis, but do I now also have cancer? Test come back. Oh, I've seen this happen. Kings and queens, princes and princesses of Israel. I have seen this happen. I have seen a doctor say this. No, you don't have cancer. And quite frankly, I don't know what's causing this. Never once. I have seen physicians never once question the chemicals. Now, I'm not going to say that all physicians, I'll tell you, I know some just techs. They're very good clinicians. The first thing they're looking at is the chemical. I know some nurses. First thing they're looking for, these chemicals. Let's see what your medications are. Oh yeah, this medication, it can cause that, it can cause it. But I have seen what the Western Hemisphere considers that as the end of the road when it comes to the personnel that practices medicine, which would be a physician, a doctor. I've seen doctors that they won't even, and again, not all of them, but I have seen it. And not just once or twice. I have seen this happen several times, several hundreds of times, several thousands of times. I have seen it. I have been approached and asked, what do you think it is? And I'm sitting there like, well, let's look at all the variables. Now, these are the people. I've seen doctors that have prescribed a medicine, not regard the medicine as to a certain sign or symptom when it was the most likely cause of the certain sign or symptom. I would tell them, let's look at all the variables. Step back, take a step back, look at the whole picture. Let's start with the very basics, their lifestyle. No, they don't do anything that leads to that, okay. And their lifestyle is going to include their diet. So then I'll say, okay, let's look at the disease process of disorder. No, it doesn't cause this. Then I say, so what are y'all giving them to treat that? And then it's like light bulbs fly. Oh, that's gotta be what it is. But you'd already sent the damn patient back to the house Told him to take that shit again tomorrow morning. It has become a norm. That is a norm. Let me keep going. Back pain, sudden and severe. Lump or swelling in the stomach. That is alarming as hell. I don't know if anyone has ever had one. The the mortality rate of it. But if you've had an abdominal aortic aneurysm, it's when the descending aorta, again, the aorta is the biggest artery in the body, but when there is a rupture or a tear, it looks like this: a lump or swelling in the stomach. If it's early enough, or well, actually, if it's tight enough, first, if your pulse is high enough, you can feel the blood squirting out with your heartbeat. Then it fills your stomach up and you so tight, you can literally feel the vibration as this artery under all this pressure. But this mimics that. Not so much as the heartbeat part, but the lump or swelling in the stomach. Oh yeah, this mimics what some people, it's more commonly called a AAA, but it's an ana. This is crazy. Let me just keep going. Bleeding gums, muscle weakness, sudden and progressive. Again, we're talking about someone who has multiple sclerosis. The thing about the muscles is they are innervated by the nerves. This can mimic the disease process because if the brain is blocked from, let's say you trying to tell yourself to pick up a cup, but it just seems like you're so weak you can't get there because the brain's message is being blocked. This is a direct mimic of the disease process itself. This is something that multiple sclerosis can give the appearance of. It's not that the person is actually weak, but what is weak is that signal being sent to that muscle to pick up that cup, pick up that cup. I want to pick up that cup so bad, but I'm moving so slow. I wanted to pick it up 2 minutes ago, but I'm moving so slow. I just feel so weak. I had to get to this cup. The chemical does this chemical to treat that disease process does that. Blindness, nausea, blurred or decreased vision. So all the way from blurred or decreased vision to all the way to blindness. Listen to this next one. This is used to treat a disease process or disorder of the central nervous system. Listen to this: nerve pain. I can't make this shit up. Chest discomfort or heaviness, nosebleed, clear or bloody discharge from the nipple. Something else from, this is crazy. That will freak the normal human woman the fuck out to see a bloody discharge from their areola. This is insane. This is just one. I'm not gonna even go through the rest of this. I'm gonna leave the link for this. I'm gonna leave the link for this. There's more. Oh my goodness, there is more. lack or loss of strength, stuffy or runny nose, double vision. You got blurred vision, lack of vision, blindness, and now double vision. Now, these right here, man, I kind of really do want to go into. I'm going to go into some of the more pressing. Now, again, this is used to treat a person whose whole central nervous system is involved. This particular drug can now involve other whole systems, such as the cardiovascular system. So your brain and your spinal cord are already involved. This particular chemical can now involve your heart and blood vessel, vasodilation, chest pain, palpitations, tachycardia, hypertension, hypotension. This can cause your blood pressure to be high or cause it to be low. This one chemical. Mid-systolic click, systolic murmur, heart murmur, atrial field, bradycardia, fourth heart sound, posterior hypotension, varicose veins, warts and dry skin. It's people that get varicose veins just naturally. They don't need no damn help. I'm definitely going to let's go to respiratory, because I promise you, that right there for me, man, the feeling of not being able to breathe, knowing that that's something that you have to do. Let's look at some things with your respiratory. This drug can affect your respiratory system. It looks to be an alpha and beta antagonist, this particular. I hadn't gone and looked at the actual breakdown of Copaxone, but let's just look at some of these things. Dyspnea, that's difficulty breathing. Rhinitis, bronchitis, a cough, laryngospasms, hyperventilation, hay fever. This drug can cause asthma, pneumonia, epistaxis, hypoventilation, and can all out alter your voice. Do you really want this drug in you? And you have to metabolize. You have to get all of this drug out of your body. That's what metabolizing. There are people right now today taking this particular chemical, have been taking it for years, and have been told you have to take it for the rest of your life. If you are someone that takes this, I want to ask you, is the reward to you, if you are taking this, is the reward truly greater than the risk? Because I promise you, I'm gonna go over some natural things. They don't cause none of this. Not one damn thing of this does it cause. Let's go look at this other drug, man. Let's look at this other one. Vumerity. Let's just look at this side effects. First things mentioned. Again, link is going to be in the description. Vumerity may cause serious side effects, including, first thing, say, allergic reaction, progressive multifocal leuko encephalopathy. Listen to this. People, this is used to treat a disease process of the central nervous system, which includes the brain and spinal cord. Look at what this chemical will do, can do. It can give you a rare brain infection that usually leads to death or severe disability over a period of weeks or months. I want to ask you again, because when they told you about it, they said, but the rewards are greater than the risk. If you taking this, you already dealing with a disease process or disorder that is directly, the brain is directly involved in the disease process of disorder. Let's just give you something that'll give you an infection to that which is involved in the disease process of disorder. Let's do that. That sound like an excellent idea. Why that is not a contraindication for administering this chemical to someone who has a disease process or disorder where the brain is already involved. I know why. I'll tell you, because it's sales. You can get some money off of it. All I got to do is sell them on what the reward is higher than the risk. If I can sell them on that, and I get paid. This infection will kill you. Can kill you. In fact, it usually kills people. Or it will do exactly what the disease process of MS does, and that's cause severe disability. That's exactly what multiple sclerosis does. Look at this. Herpes zoster infections, including central nervous system infections. If you pay attention to this particular chemical, if you're taking this particular chemical, understand this chemical is breaking down your immune system. It's killing it. Not only is it killing it, it's allowing for the introduction of such infections. The next bullet just says other serious infections. Further proof, this is killing your immune system. This can cause a decrease in your white cell count. It's killing some white blood cells, because anytime there's an infection, you're going to have an increase in white blood cell count. This particular chemical can cause infections, and while killing your immune system, opening you up to infections, it then starts killing your white blood cells, or can. Let me reiterate. These are things that this chemical can do, but they sell my people on the risk. The reward is greater than the risk. then some shit like this happens. Killing my people. I don't give a damn about the other. I'm gonna be frank with you. The other heathen, all the other nation, all the other biblical nationalities, I could care less. But my people, the chosen people, the special, peculiar people, this is very concerning, to say the least, to say the very least. And some of my people are taking this. And they're taking it for multiple sclerosis. And they can have these things happen. On top of the fact of what the multiple sclerosis can do to them. Let me keep going. Wayne Sharon, tell me if you've experienced any of these. Just from having multiple sclerosis, if you're in the chat. Severe tiredness. And I say any of these, not all of these. Severe tiredness, loss of appetite, pain on the right side of your stomach, have dark or brown, tea-colored urine, yellowing of your skin or white part of your eye. I've said what that is before. That's known as jaundice. It's known as jaundice. This chemical can cause you to have jaundice. Now, jaundice is a sign or symptom of other types of disease processes and disorders. Let me just keep going. I'm going to go on and finish this out. Most common side effects of Vumerity include flushing, redness, itching or rash, nausea, vomiting, diarrhea, stomach pain or indigestion. Flushing and stomach problems are the most common reactions, especially at the start of therapy, and may decrease over time. Taking Vumerity with food, avoid high fat, high calorie meal or snack, may help reduce flushing. Call your healthcare provider if you have any of these symptoms and they bother you or they do not go away. I promise you, you better contact more than just your primary care physician. You need to get you a neurologist. You're going to have to get somebody. You're going to have to get somebody from phlebotomy. But you get some of these infections systemic wide in your bloodstream, you become septic with some of these infections. I promise you, your primary care physician is just one of many people you need to be talking to. That's just from this one. So now, with that, I'm going to stop sharing my screen. Because I've added to my Word documents. A lot of y'all, you know, and I'm going to tell y'all now, if y'all want a list of the Word document, as I'm going with it, I'm adding to it as I'm doing the Truth for Thoughts. If you want a copy of this document, contact me on Instagram, or I would prefer you contact me on Instagram with your email address, because I don't really want you to just give your email address away there in the chat. Now you can. I have no problem. I've done it several times. I have no problem with it. But that's just the preference of the person. That's at your preference. But as you can see, let me go and share my screen on the document so you can see. Share my screen. And as you can see, start at the very top. It's a lot of herbs on here for a number of different things. So I doing the CNS and I'm focusing on the central nervous system. I mean on the CNS with in regards to multiple sclerosis. I'm gonna go over a few of these. I'm definitely gonna go over one that I gave you, Queen Sharon. I'm gonna go over vervain. There are multiples of vervain. The one I told you about is blue vervain, but I'm gonna go over that specific thing in a little depth. That specific herb in a little depth. First, I'm gonna get these. Some things. If you have multiple sclerosis, some natural thing. When you metabolize this, you metabolize it naturally. It don't stay in your body for forever as a horrible chemical. We got maca roots. Well, what is maca root? Maca root, or Lepidium mayani, is rich in nutrients the body needs, such as silver, iodine, iron. Remember the word zinc, and remember the word magnesium. Zinc, calcium, and magnesium, and they are all important for treating MS or multiple sclerosis. Furthermore, maca root contains a wide range of vitamins like vitamin C, D, B1, B2, and E. It does exactly the opposite of what that last chemical does or can do. This actually helps to build up the immune system. Let's keep going. Moreover, it is rich in many types of amino acids, most importantly, the amino acid arginine. Lepidium mayani helps treat MS by treating the chronic or over time fatigue syndrome, or the feeling of tiredness, and by maintaining the body's balance. It is also nutritional and balances, as it proved earlier, the immune system. This is just me, right? It would be my preference to take that with no side effect, no possibilities of side effect. Outside of, am I allergic to it? I would know the first time I took it. 9 times out of 10, probably not. I'd much rather take this. But let's just keep it. Licorice. Licorice. I hate saying the genus name of licorice, but let me go on and give it another whirl. Licorice, also known as Glycyrrhiza glabra, has been used since old times, ancient times, for treating various diseases. It is no irony or coincidence that they say that again. Even the Levites used to treat with herbs, just like, if not including, licorice. It is useful for treating respiratory system disorders, stomach diseases, autoimmune diseases, and rheumatoid arthritis. Moreover, it helps alleviate the muscle spasms for people with multiple sclerosis and helps balance the immune system. You might be beginning to see a common theme. Buplurum falcatum. is one of the traditional Chinese medicinal herbs. Many studies recently revealed its significant benefits in treating terminal diseases like cancer. Moreover, it helps treat muscle spasms, fatigue, dizziness, and balancing the body. It is also an adaptogen that contributes in balancing the immune system and helping the MS patient adapt to the disease. Feverfew. And if you've watched some of the other Truth for Thoughts, or if you've gotten this document prior to me updating it to this, you've seen feverfew before. This is a herb that, boy, multiple things. It helps in the treatment of multiple things. So let's just read about it. Feverfew, or Tennessee parthenium, is of the old medicinal herbs. It's going to say this next thing, and I'm going to tell you, I'm going to be brutally honest with you. They learned this from a certain people, but let's just, you heard me say it, now let's read it. Used by the pharaohs and the ancient Greeks for treating many diseases, yet they learned this from a certain people. Again, it is efficient in treating rheumatism and alleviating its severe pain. In addition to treating dizziness and imbalance in people with multiple sclerosis, and balances the immune system. Have you started seeing that word immune system over and over and over? I am asking this out of sheer curiosity. Ginkgo biloba. Aside from congenitive improvements, there are other areas in which the multiple sclerosis patient could benefit from taking ginkgo biloba as well. Some of these include reduce risk of infection. And I'm telling you, that's directly related to the immune system. Since infections can negatively impact the disease and lead to relapses, thus it is important to make sure the immune system is built up to keep multiple sclerosis from relapse. Did the doctor tell you that? Or did he give you a chemical, kind of like the last one we saw, that literally opens you up for infections, which can negatively impact the disease and lead to relapse? Did the doctor tell you that when he sold you on this? Is if you're taking that last medication, when he sold you on, but the benefits outweigh the risk. Did he tell you this? And ginkgo biloba has antibacterial properties. It could be advantageous in reducing the risk of a patient getting an infection of any kind, not of some kind. The exact word is any kind. Improve circulation. Blood flow can assist in keeping muscles and other parts of the body healthier. I kind of explained that when I said about the muscles seizing, and it uses a bunch of, it takes a bunch of oxygen. Well, the only way that oxygen can get there, I said when they put a pulse oximeter, it shows the percent of oxygen saturated in the blood. The only way to feed those muscles oxygen is through the blood. Blood flow can assist in keeping muscles and other parts of the body healthier. So even with MS relapses, causes issue with mobility, improved blood flow can keep oxygen coming to the muscle. Israel, understand, I cannot lie to you. I have repented for that. But also understand, I will share any and all knowledge I have about any and everything that I have knowledge of. I literally told you all this before reading that this particular herb will achieve just that. This will reduce atrophy, pain, stiffness, cramps, and spasms. Anxiety. Ginkgo biloba helps with anxiety? Let's just see. Many MS or multiple sclerosis patients dealing with symptoms have issues with anxiety or depression. There is no irony or coincidence in that, because I promise you, and Queen Sharon, you probably can attest to this. When that incident happened in McDonald's, did you panic? Did you begin to panic? Because all that panicking is the onset of anxiety. When you were attempting to talk and people couldn't really make out what you were saying, did you begin to panic somewhat? Did that anxiety start building up? Ginkgo biloba helps with that. So, and Ginkgo biloba has shown promise in reducing anxiety, dizziness, quite possibly related to improved blood flow. Ginkgo biloba has been effective in reducing dizziness and imbalance in patients as with vertigo. Now, if you've never heard of vertigo or don't know what vertigo is when you have an imbalance due to the inner ear. The inner ear plays a lot in your balance. If your inner ear has an infection, they could diagnose you, yes, with an inner ear infection, or they can just simply say, especially if you're symptomatic, meaning when you walk, you start walking to the side of whichever ear is infected. If you are symptomatic, they can simply say you got vertigo. You have vertigo secondary to an ear infection on your right side. Okay. Similarly, it's possible that it can be helpful for patients with multiple sclerosis who suffer from dizziness as one of their symptoms. Studies on ginkgo biloba showed that it can significantly improve the functional performance in multiple sclerosis patients. Fatigue, symptom severity, as well as functionality showed much improvement in those taking 240 milligrams of a special extract of ginkgo biloba every day. But I want you to remember there were some things that I told you to remember, and I'm going to go back up here to them. In regards to mocha root, there were some minerals. They call them nutrients There were some minerals that I told you to remember. Zinc helps with the immune system. And magnesium, I told you to remember those for a reason. The zinc is for the immune system, but the magnesium, now there's a dietary law that Israel must follow. And of the fowls of the sea, you are to eat fish with scales, with fins and scales, right? A major source of magnesium comes from fish, but we're going to get that. I'm going to touch that a little later. But I just really want you to remember that before we get too deep into this. Ashwagandha, known as the queen of Ayurveda. Ashwagandha is extensively used in Indian Ayurvedic medicines. The herb possesses vast benefits, including anti-stress, anti-cancer, and neurodegenerative pathologies. Not a chemical, Israel. This is an herb. Studies have shown that the leaves of ashwagandha possesses cognitive enhancers that improve executive functions, memory, motivation, etc. Studies also show that the effects of ashwagandha leaf extracts are multidimensional that include reversal of Alzheimer's and Parkinson's pathologies, protections against environmental neurotoxins, and enhancement of memory. The root extracts of ashwagandha, meanwhile, have proved. 1 Thessalonians 5:21 says, "Prove all things, hold fast that which is good." You can find proving in the Bible about any and everything. In fact, Israel, you are to prove me. You are to prove me. You are to be able to discern that either I know what I'm talking about, even in regards to the word. Either I know what I'm talking about or I don't. This herb has proved to be useful for the treatment of dyskinesia or impairment of voluntary movement. Now, there are a couple of things that are needed for voluntary movement. That's muscle and nerves. But those nerves start with a signal from the brain. In multiple sclerosis, that signal can be blocked, whether right at the brain via swelling or lesion or lesions, or at the spinal cord via the same things, swelling or lesion or lesions. This is proven. An herb that is proven to aid with that. Let's go to the next one. Let's just go to the next one. Dandelion. Dandelion root and leaf. Dandelion has been used in herbal medicines in Korea. Both the root and the leaf of the plant are said to possess medicinal properties. Studies show, proven, that dandelion has antioxidant, anti-inflammatory properties, which can be helpful in patients with MS. It also possesses properties to reduce fatigue, which is one of the main symptoms of MS. Huamarine, better known as Chinese hemp seed. Huamarine belongs to the cannabis family and is used extensively in both conventional and alternative medicine. Queen Sharon, I know you saw cannabis sativa in that list that I specifically sent you. This is to break it down a little bit more so you'll know what of cannabis sativa is more effective. Now, cannabis sativa can be used for the pain itself because it can be a very painful, any debilitating disease process or disorder can be extremely painful. So yes, the cannabis sativa will, or medicinal herb, medicinal weed would definitely would help in the ailment of pain. But listen to this. Coumarin belongs to the cannabis family and is used extensively in both conventional and alternative medicine. Though known mostly as a sedative, it has a soothing effect on the central nervous system as well. Hemp extracts also possess properties that help reduce spasticity. That means that's muscle spasm. That is caused by some of the chemicals that are given for the same treatment of the same disease process. This helps to eliminate that or keep that from happening. Neurodegeneration and inflammation. Other interesting factors of hemp seed is that its oil is up to 80% rich in polyunsaturated fatty acids. It is also an exceptionally rich source of essential fatty acids, linoleic acid or omega-6, and alpha linolenic acid or omega-3. This is all in this one natural herb, Israel. All these make hemp seed an effective natural treatment option for sclerosis. I remember I told you about magnesium. Magnesium is crucial for a variety of bodily functions. Research shows that magnesium deficiencies may also be associated with myelin damage, leading to multiple sclerosis and a number of other chronic and progressive conditions. Using magnesium supplements and opting for a diet, the dietary law. Say again, the Most High put anything that the Most High put into effect is in effect for a specific purpose, be it unbeknownst to we as man, even as his chosen, unbeknownst to us as to why everything about the Most High, anything that he declares, anything that he commands, it's for a reason. Listen to this. Now, I'm not going to tell you to go get a magnesium supplement. I'm going to allow this to tell you exactly what I would do. Leading to multiple sclerosis and a number of other chronic and progressive conditions. Using magnesium supplements and opting for a diet that is rich in natural sources of magnesium like leafy greens, nuts, whole wheat. I want you to hear this next one and hear it well. Fish, but not just any fish. No. It is written which fish. And I promise you, if you eat that fish, you're going to get plenty of magnesium, etc., can be helpful in preventing a deficiency that can aggravate multiple sclerosis symptoms. I would tell people, especially my nation, if you have multiple sclerosis, regardless of the bullshit that we say, like, shit, if I eat enough chicken, I'm gonna turn into a chicken. If you have multiple sclerosis, you cannot eat enough fish that fall in line with the dietary law. You can't eat enough of it. And that is just the truth. Because I cannot lie to you. A combination of all or some of these natural treatments can definitely bring down the severity of multiple sclerosis symptoms and manage the condition effectively. So wait a minute. Does this mean that there's further proof? Now you got to understand, these laws, statutes, and commandments were only given to a certain people. Was the Most High? Did the dietary laws and the fact of, he said what kind of fish, what kind of fowls of the sea? But could he had been, just could you fathom this? Could the Most High have been looking out for you? You didn't know it. You know, he knew it was good for you, and he knew every reason why. We just going over one particular reason why it can be good. But could you fathom it? Now, Queen Sharon, if you're in the chat, I know you recognize these others. I told you to do some research on. Now, hopefully, and there you see the cannabis sativa, hopefully you've done some research. But just in case, or if you've been too busy, not able to get to it, I understand. I'm going to continue to give the descriptions of why these particular herbs are good for multiple sclerosis, okay? And if you want a copy of this, I'll say to you again, you can DM me on Instagram. I'll have my Instagram in the description as well. If you don't have Instagram, you can send your email here in the live chat, and I will email you a copy of this list. So now I'm going to stop sharing my screen. Israel, I cannot stress to you that the most, again, here's another key indicator. Most High made these herbs, said they were good, said they were for meat and for the service of man. Could you fathom the possibility of he knew one, what they are good for? Two, it's going to be some things going to come your way, Israel. I already know they going to come your way. But I put some stuff down there for y'all. For the service of man, up to and including medicinal service. So, with that, Israel, I bid you Shabbat Shalom, as it should be probably the end of the Sabbath, when this is ending, when this truth of thought is ending. I do want to tell you, Israel, if you've not seen any of the other medical insights from you, Israel, I implore you to go look at them. And I will start at part 1, go to part 2, part 3. This is part 4. There's a vast amount of information and knowledge in them. Whether you know that information or not, it is definitely there for you. I will tell you, in my experience, the majority of Israel that I've run into, they didn't have that knowledge. So, but I will tell you, I definitely put it out there for us. All right. With that, Israel, it's your brother Marcus G. I love you and I bid you shalom. Till next time, be it the Most High will.